Georgia has the third highest number of uninsured people in the nation.
We've got to do something to lower cost and provide more access.
But it is clear from campaign ads, press events, and Twitter, gubernatorial candidates don't agree on what we should do about it.
The solution is not more government.
Southern states have refused to expand Medicaid.
Part of that divide stems from basic party philosophies. To get a better understanding of what that means for you, we talked with Emory Political Science Associate Professor Andrew Gillespie and Georgia State Law Professor Aaron Fusey-Brown.
This really comes down to a perception of what a person thinks the proper role of government should be. The Democratic Party has become the party of social safety nets. In contrast, the Republican Party has espoused a much more individualistic, market-based approach.
That's why in 2019, Governor Brian Kemp created an alternative plan to help some with lower incomes pay for health insurance as long as they were in school, worked, or volunteered 80 hours a month.
Part of it is this idea that work is dignified and that everybody should participate.
But the Biden administration felt the work requirement created an unfair burden.
It causes fewer people to actually qualify for, Medicaid coverage, even if they would be eligible, just because they can't keep up with the record-keeping requirements.
Think of people without an internet connection or those who can't work 80 hours a month because they're a full-time caregiver to a disabled child. But in August, a U.S. District Court judge sided with Governor Kemp. Kemp says Medicaid is just a bad program. Not enough doctors accepted and costs keep rising.
Governor Kemp is going to make this, an issue of thinking about, government intrusion.
Stacey Abrams argues the feds would pick up 90% of the Medicaid tab, and our federal tax dollars are already going to those 38 states that have expanded, with none of it coming back to us.
Costs are going up everywhere. This is a way to help expand insurance access to people who actually are needed.
Democrats say expansion makes sense for the economy as a whole.
You never know when you're going to have an accident, come down with chronic illness, so the more people who get covered means that you don't have people who are going to be forced into poverty or forced into bankruptcy.
But at the heart of the opposition, Fusey-Brown says, is who started the push for expansion in the first place.
Consensus never comes easily.
The Medicaid expansion was part of Obamacare, right? It was part of the Affordable Care Act, which was the signature domestic accomplishment of President Obama.
The 12 states that have declined to expand Medicaid coverage have either a Republican governor or controlled legislature.
I think that the argument against it is mostly ideological.
What happens if we just put ideology aside and just look at the numbers? How much would closing the gap really cost us? We'll tackle the math next time.